Intravenous, or IV, cannulation. IV access and fluid administration is indicated when you determine the real or potential need for IV medication or substrate administration or fluid therapy. The display of the equipment shown here includes a 2x2 gauze square, op site, saline lock, tourniquet, alcohol swabs, saline-filled syringe, and a catheter over needle of an appropriate size for the site you have selected. Always prepare your equipment in advance. Apply a tourniquet proximal to the access site in advance and allow time for the vein to rise. It is helpful to leave the arm in a dependent position, encouraging blood to backfill in the vein. Landmarking to your preferred vein may require you to palpate for the vein or look for coloration consistent with veins in the area. Don't rush. Look and feel for the vein that you know you can get and start distally. If you are unsuccessful, you can move to an access location proximal on the limb. Once you have selected your site, cleanse it with an alcohol swab and allow the area to dry. Next, select an appropriate sized catheter over needle depending on the access location and the size of the vein to be cannulated. Generally, for adults, select a 20 gauge for the hand, 18 gauge for the forearm, and a 16 or 14 gauge for the antecubital fossa, or AC. Anchor the vein with the thumb of your non-dominant hand to straighten the vein and to minimize rolling as you advance the needle into the vein. With your dominant hand, grasp the catheter with an overhand grip. The angle of approach is approximately 35 to 45 degrees from the patient's skin surface. Pierce the skin with a smooth motion and observe the hub for blood to enter the hub chamber. This blood is from the tip of the needle inside the vein. However, the catheter is not yet inside the vein. Lower the angle of the catheter chamber to approximately 15 degrees to bring the needle and the catheter in line with the vein and advance another few millimeters. Once inside the vein, the catheter should slide easily off the needle into the vein while you retract simultaneously the needle from the catheter. Prior to retracting the needle, release the pressure from the tourniquet. Also, occlude the vein and the catheter tip as you remove the needle completely from the catheter. This will help to reduce the pressure in the vein and minimize backflow up the catheter when the needle is removed. You will have to maintain this pressure until the IV tubing or saline lock is attached to the hub. In this demonstration, a primed saline lock is attached and then the hub secured with an op site. To ensure the line is patent, attach a saline-filled syringe and infuse 10 milliliters of saline. Alternatively, attach a primed IV bag and tubing and observe the site while infusing fluid from the IV bag. The line must be discontinued and the catheter removed if swelling is observed around the catheter site, suggesting the IV catheter is no longer in the vein. Once the patency of the line is established, secure the tubing with or without the saline lock to ensure that the IV catheter is not easily dislodged. Continue to monitor the site and the IV infusion set for changes in the patency of the line.